A vaccine for the H1N1 virus, or swine flu, is still a month away at best. But healthcare workers are already being bumped to the front of the line. Those who work in healthcare are being strongly urged by the federal government to get immunized once the swine flu vaccine is available. The state of New York is taking it one step further. YNN Health reporter Casey Bortnick joins us now with more.
Yes, Scott. Healthcare professionals do have an obligation to protect their patients, but at what cost? For one healthcare worker, a New York State directive intended to stop the spread of the swine flu goes too far. Just a word like pandemic
it's very scary.
Is enough to scare anyone in the healthcare field. For Deborah Gearhart, there are words even scarier.
Whenever you hear mandatory, required, you start to get a little bit anxious.
Deborah's been a registered nurse for 15 years. She's never had a flu shot.
I feel that everyone should have a choice.
She recently learned she doesn't have a choice.
It was just all of a sudden one day we're told you will receive the flu injection.
The New York State Department of Health is ordering thousands of healthcare workers to be immunized against the seasonal and swine flu.
As a parent, as a doctor, as a public health professional, please get your vaccine.
The state's health commissioner says refusal to be immunized against the H1N1 virus could increase the spread of the disease and stress an already overwhelmed medical system. He says when a vaccine is approved, there's no reason to believe it won't be safe.
It goes through that same system and the testing, and so I'll have the confidence in it that the Food and Drug Administration and the Centers for Disease Control put in it.
After doing her own research, Deborah isn't as confident in a potential vaccine.
And it's left a lot of questions right now for me.
Questions that have left her with one final decision.
I so strongly don't want to get a vaccine that I'm not comfortable getting injected into my body. If I refuse, I can't work in nursing.
It's a choice she wishes she didn't have to make.
It's just so surreal for me right now. I don't know what I will do.
All critical care healthcare workers are being told to get a flu shot. But that's a mandate that has some local workers upset. News 4's Lori Schultz tells us why.
Registered nurse Terry Shelter gets a seasonal flu shot every year, but she objects to New York's new law that now requires most workers in hospitals to get immunized against both the seasonal and possibly swine flu as a condition of employment.
And I think there is a general suspicion about immunizations.
New York is bracing for a spike in swine flu cases this fall and is the first state to now require a segment of health workers to get immunized. Local 1168 President John Klein says it hasn't been an easy sell and infringes on free choice rights.
This mandate by the state is forcing them to choose your work or your health.
Studies show that fewer than half of all health workers voluntarily get the seasonal flu shot. It's believed that real protection against any disease requires vaccination rates over 90%. Kaleida supports the state's effort.
Well, for us, we need a healthy workforce in order to protect our patients, especially those who are most vulnerable to the seasonal flu.
Will someone be fired if they don't get the shot?
Well, we met with our labor leadership yesterday, Tuesday, so we're working with them to figure out what's the correct way to handle this. We don't want to be too burdensome, but we also have an obligation to our patient and to our workforce to protect everybody.
Under the new flu shot law, workers can opt out, but only for certain health reasons, like if they're allergic to the shot. Health workers have until November 30th to get the shots. Terry already got the flu shot, but fears the swine flu vaccine. Testing is still underway.
I am not prepared at this point to get it.
These people are fearful that the side effects are so unknown that they're, to some degree, are just being guinea pigs.
Well, critics say the swine flu vaccine is being fast-tracked without adequate safety tests. Now, infectious disease specialists began testing last month and so far haven't seen any serious complications. This particular vaccine won't be available until the end of October. Live, Lori Schultz, News 4.
Healthcare workers from across the state are rallying in Albany this noon. The state health department issued an emergency regulation in August requiring all healthcare workers be immunized against seasonal and swine flu. If they chose not to, those workers would lose their jobs. But some of the workers say they don't want to be guinea pigs for a vaccine they believe hasn't been fully tested.
Have the latest on the H1N1 flu. All 50 states have now ordered the vaccinations, and nearly 2.4 million doses are now available. Children are the first ones in line, as you know, to get immunized, but some parents are saying no and are worried the shots are not safe. So moments ago, to get some answers, I talked with Health and Human Services Secretary Kathleen Sebelius. Secretary Sebelius, thank you very much for joining us this morning. There is a new poll out this morning that shows that the majority of Americans are reluctant or unsure about getting the H1N1 vaccine for themselves or for their children. So what do you say to them, especially parents, to convince them that the vaccine is indeed safe?
Well, Robin, this vaccine is being made exactly the same way seasonal flu vaccine has been made year in and year out. So while this is a new virus, and the great news is we have the right vaccine for this virus, we also have years of clinical data on seasonal flu vaccine and a great safety record.
Secretary Sebelius, it's not just, though, parents concerned about the vaccine. We are hearing from a number of doctors concerned about giving the vaccine. So how do you convince them?
Well, again, we're doing everything we can to reach out to providers. We've done a lot with OBGYNs because we know that pregnant women are particular targets. And, you know, when I was pregnant, I was very reluctant to take anything, certainly to try anything new. I didn't want to do anything to harm my baby, but what we've been told over and over again by the scientists, and that's what we want people to do, look at what we know from the science of the vaccination, is that the risk for pregnant women is much higher getting the flu than getting the vaccine. And in fact, the only way pregnant women can protect themselves and their babies once the baby is born is by getting vaccinated.
When can we see it nationwide?
Well, it's the early shipments have started as of Monday, and there is some vaccine in St. Louis yesterday. They were receiving their first doses. We're going to continue to push it out as fast as it comes off the production line. Our target date always to begin vaccine distribution was October 15th, so we're a bit ahead of the curve. That's good, but limited amounts so far are being available. As soon as it comes off the lines, we're going to get it to our state and local partners.
We have, of course, reported the tragic deaths among those across the country, including some teenagers, but we are also seeing that the vast majority of people are reporting mild symptoms. So if that is indeed the case, why get vaccinated?
Well, I think I hear that all the time, Robin. You know, this is just the flu. Just the flu kills people. It puts people in the hospital. We know that they're going to be, we now have over 600 deaths reported. So taking the chance that you or your roommate or your child may be one of those maybe rare but serious cases, may have an underlying impact, may expose someone else.
Secretary Sebelius, thank you very much for your time this morning.
Sure.
We
Great to
appreciate
talk to you.
All right. Have a good day.